Yeast infection during pregnancy. What can be done about it? The organ most commonly hit by yeast infection is the vagina. While the vagina naturally contains yeast cultures in it, fungal populations can explode to unhealthy levels due to certain conditions. This overpopulation of fungi is what causes yeast infection. This condition, commonly known as candidiasis, because it is caused by the fungus genus Candida, affects nearly 75% of women at least once in their lifetimes. Yeast infection during pregnancy happens as well. Actually, it is during pregnancy that a woman is most susceptible to contracting a case of yeast infection. So why is yeast infection during pregnancy very prevalent? It can be traced to the hormones produced by the female body during pregnancy. Estrogen, the primary female hormone, is present in elevated levels during pregnancy. This causes the vagina to produce additional amounts of glycogen. This situation is actually conducive to the multiplication of Candida fungi, the cause of yeast infection. The yeast uses the additional glycogen as a food source, enabling it to multiply in numbers exceeding normal levels. Infection takes place when there is an excessively large population of yeast. The risk of a yeast infection is increased if the person is also taking antibiotics, as this medication kills good bacteria in the vagina as a side effect. Having a yeast infection during pregnancy is risky due to the following reasons. During and immediately after pregnancy, the woman has a weakened immune system because pregnancy is a physically demanding process, putting her more at risk for complications stemming from a yeast infection. An unchecked infection could lead to bloodstream contamination by the yeast, causing multiple risks for both mother and child. Also, the yeast infection can be transmitted to the baby during delivery, with the baby's mouth as a primary site of infection. Due to the unpredictable nature of a yeast infection and the risks involved with pregnancy, it is advised that when symptoms of yeast infection during pregnancy arise, a consultation with a doctor should be arranged to arrive at a proper diagnosis. Sometimes, symptoms of yeast infection show up as similar to that of other diseases, such as bacterial infections and some forms of sexually transmitted diseases. As for the cure, only antifungal creams and suppositories are usually recommended as medication for pregnant women. Oral medications are not recommended because they can have potentially unsafe effects during pregnancy. To keep the child safe, the infection must clear up at least 10 to 14 days before delivery. Before taking any kind of medication, it must be ensured first that the drug is safe to use during pregnancy. Ever thought of curing your yeast infection permanently, once and for all? If so, visit www.cureyeastinfectionholistically.com for more free videos that will reveal to you a clinically researched system that will eliminate yeast infection for good.